Good day, interns. This is a discussion on the physical examination of urine. The scope of this discussion includes the determination of the urine color, clarity, and specific gravity. First, urochrome is the pigment that causes the yellow color of urine, while uroerythrin is a pink pigment that is evident in refrigerated specimens. Urobilin is an oxidation product of urobilinogen and it causes an orange-brown color. While for the clarity, this refers to the transparency or turbidity of the urine specimen. These can be graded as clear, hazy, cloudy, turbid, and milky. Okay, next. Specific gravity is defined as the density of a solution compared with the density of a similar volume of distilled water at a similar temperature. So first, isosthenuric is specific gravity that is equivalent to 1.010, while hyposthenuric is a specific gravity of less than 1.010, and hypersthenuric is a specific gravity that is equivalent to greater than 1.010. The normal specific gravity is equivalent to 1.02 to 1.035, and this is always dependent on the patient's state of hydration. Okay, next, let us proceed to the dark yellow, amber, or orange urine. For normal causes, this can be caused by concentrated specimens, and for abnormal causes, this can be because there is a presence of bilirubin, which is evident with persistent yellow foam, and this can be detected in chemical examination. This can also be because of the photooxidation of urobilinogen to urobilin, and this can also be because of the administration of phenazopyridine or azogastrin compounds, which do not have persistent yellow foam. Next is for red, pink, or brown colored urine. This can be because of menstrual contamination for the ingestion of highly pigmented food and medications. But abnormally, RBCs can be present and they can present as red and cloudy urine. And hemoglobin or myoglobin can also be present, in contrast, which present as red and clear, and porphyrins, which give a port wine color to urine. And next, there are no normal causes that give urine a brown or black color. But abnormally, this can be caused by melanin, which is an oxidation product of melanogen, and also homogentisic acid, which is a metabolite of phenylalanine that can be seen in alkaptonuria. Medications that can also cause brown or black urine are levodopa, methyldopa, phenyl derivatives, and metronidazole. Next is for the causes of blue or green urine. For green, these can be caused by chlorates, phenyl derivatives in IV medications, and for blue, these can be because of methocarbamol, methylene blue, and amitriptyline. Abnormally, blue or green urine can also be caused by Pseudomonas infection, and there are instances where there is a purple staining in catheters. These can be because of Klebsiella and Providentia species. Next, let us discuss the urine clarity. Normally, urine should be clear, but it can be expected that there would be precipitation of amorphous phosphates and carbonates that may cause a white cloudiness. For non-pathologic turbidity causes in urine, haziness can be because of squamous cells and mucus, which are particularly found in specimens for women, and improperly preserved specimens also is because of prolonged standing, and also in refrigerated specimens. Other causes can be because of semen, fecal contamination, radiographic contrast media, talcum powder, and vaginal creams. Next, for the pathologic turbidity causes in urine clarity, the most commonly encountered causes are RBCs, WBCs, and bacteria. The abnormal amounts of squamous epithelial cells can also be seen, also yeasts, abnormal crystals, lymph fluid, and also lipids. And the amount of the turbidity that can be seen should always correspond to the amount of material observed during microscopy under the microscope. Next is for the assessment of specific gravity, which is done with urinometry with the use of a urinometer. A urinometer is a weighted float attached to a scale calibrated in terms of urine-specific gravity. A urinometer usually sinks to a level of 1.000 in distilled water, and it floats when it is displaced due to the additional mass of dissolved substances in urine. The only disadvantage is because it requires a large amount of urine specimen, which is usually inconvenient to collect, and this is less accurate than other methods. Next is for the assessment of specific gravity with the use of refractometry. This measures refractive index to determine concentration of dissolved particles. Refractive index is the comparison of the velocity of light in the air with the velocity of light in a solution. Advantages in refractometry is because this only requires a small volume of specimen in contrast to urinometry, and in refractometry this is 1 or 2 drops only. But for the disadvantages of refractometry, this requires correction for glucose and protein. For glucose, you have to subtract 0.004 for every 1 gram of glucose that is present, and for protein, you have to subtract 0.003 for every 1 gram of protein that is present. Next is the osmolality of urine. Molality is a term most commonly used because the solute and the solvent are both expressed in the same units of measure, which is milliosmol. Osmolality is determined by measuring the colligative property and comparing this value with the value obtained from the pure solvent, which is pure water. This is done with the use of an osmometer. Another assessment of specific gravity is done with a reagent strip, and this is based on the change in the pKa, which is the dissociation constant of a polyelectrolyte in an alkaline medium. This will be further discussed in the chemical examination of urine. Lastly, for the odor, which is not usually a part of routine urinalysis but is a notable physical property. For freshly voided urine, it is faintly aromatic, and which is normal. For foul ammonia-like smelling, this can be determinant of bacterial decomposition or UTI. For fruity and sweet smelling urine, this can be because of the presence of ketones. For maple syrup, this can be because of a genetic disorder, which is maple syrup urine. And for mousy odors, which can be found in phenylketonuria. For rancid smelling urine, which can be found in people with tyrosinemia. And for sweaty feet, which is found in isovaleric acidemia. For cabbage smelling urine, which can be because of methionine malabsorption. And for bleach smelling urine, which can be causes of contamination. Thank you for listening, and I hope you got something from this discussion.